Over 60? These 7 egg mistakes are toxic to your heart. If you have eaten eggs the same way your entire life, one small habit sitting on your breakfast plate right now might already be working against your heart, and you would have no way of knowing it because eggs that hurt you look, smell, and taste exactly like eggs that help you. Here is something that changes quietly as we move past 50 and 60, something almost nobody sits down and explains clearly. Your immune system does not bounce back from a stomach bug the way it used to back in your 30s, when a rough night usually meant you were back on your feet by morning. Your stomach produces less of the natural acid that used to kill off harmful bacteria before it could ever make you sick, sometimes because of age alone, sometimes because of common medications you may already be taking. Your kidneys and your liver process fat, cholesterol, and waste a little less efficiently every single year, quietly, without a single symptom to warn you. And your margin for error in the kitchen, the space between a small mistake and a real medical problem, gets narrower than most people ever realize, until the day it does not. Eggs are still one of the best things you can eat at this stage of life. They deliver protein, choline, and nutrients that protect your brain and your eyes exactly when you need that protection the most, at the exact age when your body starts asking for more support than it used to. But that same rich nutrition is precisely what makes a handful of common habits so risky, because there is no warning sign before the damage is done, no smell, no strange taste, nothing that tips you off in advance. I have spent over 2 decades treating patients past 60 in my own practice, and I want to walk you through the habits I see most often, the ones almost nobody realizes they are doing until it already caught up with them. We are counting down from the mistake that seems the most harmless all the way up to the one that sends the most people to urgent care every single year. Mistake number 7 is skipping the yolk entirely. If you have spent years throwing away your yolks and eating only the whites, you are not alone, but you may be undoing most of the reason eggs are good for you in the first place. This habit goes back decades to old advice that told everyone to cut cholesterol wherever possible, advice that got repeated so often it became almost automatic in kitchens across the country. The truth is, nearly all of an egg's real nutrition lives right in that yolk, including choline for memory and focus, and lutein and zeaxanthin, which are tied to protecting your eyes from age-related vision loss. The yolk is also one of the few natural food sources of vitamin D, which becomes harder for your body to produce from sunlight the older you get. The concern about dietary cholesterol driving up blood cholesterol has been reconsidered by nutrition science in recent years, and official dietary guidance has actually dropped the old strict limit on cholesterol from food entirely. Unless your own doctor has told you to limit yolks for a specific medical reason, keeping the whole egg on your plate protects your brain and your eyes far better than whites alone, and that means staying sharp enough to recognize the people you love and steady enough to keep up with them. But the very next mistake hides in plain sight in almost every kitchen in America right now. Mistake number 6 is drowning your eggs in butter, oil, or cheese. It does not feel dangerous. It feels like breakfast. A simple 2-egg meal on its own is lean and rich in protein. Add a generous pat of butter, a handful of shredded cheese, and a splash of oil to the pan, and that same plate can carry far more saturated fat than most people your age should have in one sitting. Heart health guidelines recommend keeping saturated fat to a small share of your daily calories, and one loaded omelet can quietly eat up a meaningful chunk of that allowance before lunch even begins. What makes this one sneaky is that it adds up morning after morning, slowly pushing your cholesterol inflammation in the wrong direction. The fix does not mean giving up flavor. Cook in a non-stick pan with a light coating of olive oil. Use a smaller amount of a stronger cheese like sharp cheddar, and pile on vegetables instead of extra cheese. Spinach, tomatoes, and peppers add volume and real nutrition without the extra fat. But there is a mistake tied to timing that catches people at their most relaxed moments, especially around family gatherings. Mistake number 5 is leaving cooked eggs out too long, especially at gatherings. This tends to happen exactly when nobody is thinking about food safety, at a holiday brunch surrounded by grandchildren and good conversation. Cooked egg dishes should never sit at room temperature for more than about 2 hours, or as little as 1 hour if the room is especially warm, because bacteria can multiply to unsafe levels even in food that looks completely fine. This matters even more now because stomach acid, one of your body's natural defenses, often decreases with age or because of certain medications. Keep hot dishes above 140 degrees using a warming dish. Keep cold dishes nestled in ice, and refrigerate leftovers within 2 hours in shallow containers. When in doubt, throw it out because nobody wants a happy memory to end with a trip to urgent care. And the next mistake happens without you ever noticing it at all, long before food even reaches the table. Mistake number 4 is cross-contamination without realizing it. And this one happens in kitchens every single day without anyone noticing. You crack a couple of eggs, wipe your hands on the kitchen towel, then reach for the bread, your pill organizer, or rinse the mixing bowl before using it for a fruit salad a few minutes later. In every one of those moments, you may have just transferred bacteria to something you're about to eat or touch with your bare hands. Even eggs that look perfectly clean can carry bacteria on the shell, and that bacteria survives on towels and cutting boards that are not cleaned right away, sometimes for hours. This mistake leaves no smell, no residue, nothing to warn you, and it happens most often in kitchens where the same routine has been repeated for decades without anyone ever stopping to question it. The fix takes only a few seconds. Wash your hands thoroughly right after handling eggs. Keep a separate bowl or board for raw eggs if you can, and clean any surface eggs touched with hot soapy water. It protects you, and it protects everyone sitting at your own table. But the next mistake is one almost everyone assumes is completely safe, right up until it is not. Mistake number 3 is ignoring the expiration date. Many people eat eggs past the printed date for years without ever getting sick, and that is genuinely true for a while. But as we get older, our immune systems become less resilient and our margin for error gets smaller. That date is not a random suggestion. It marks the point where an egg's natural defenses start weakening, letting bacteria multiply more easily, even when the egg still looks and smells completely normal. For someone managing a chronic condition or taking daily medication, food poisoning can become serious very quickly at this stage of life. One of the best ways to check freshness has nothing to do with the printed date at all. Place the egg in a bowl of water. A fresh egg sinks and lies flat. An older egg stands upright or floats because the air pocket inside the shell expands over time. A simple habit of placing new cartons behind older ones removes the guesswork completely. But mistake number 2 might already be sitting in your kitchen right now, encouraged by nearly everything you see online. Mistake number 2 is undercooking your eggs. Runny yolks and barely set whites look beautiful in online videos, but what looks appealing on a screen is not always the safest choice on your plate at this age. Both the white and the yolk need to reach a safe internal temperature to destroy harmful bacteria. And at that point, both will be fully set, not runny. A firm yolk does not mean you overcooked your eggs, it means you cooked them safely. An illness that causes only mild discomfort in a younger adult can become far more serious for someone managing diabetes or heart disease, simply because the immune system becomes less effective at fighting infection with age. Color alone is not reliable, since the outside can look done while the inside has not reached a safe temperature. A simple food thermometer removes all the guesswork, no more relying on appearance. And now we arrive at the mistake that tops this entire list, one hiding quietly inside some of the most treasured family recipes passed down for generations. Mistake number 1 is using raw eggs in uncooked recipes. Homemade eggnog during the holidays, classic Caesar dressing, chocolate mousse made the exact way your mother or grandmother used to make it. These feel like family tradition, which is exactly why this mistake is so easy to overlook year after year. Raw eggs can carry salmonella bacteria inside the egg itself, not only on the shell, which means even a clean, uncracked, properly refrigerated egg can still pose a real risk if it is never cooked at all. For seniors, a salmonella infection is far more than a few uncomfortable days on the couch because age-related changes in digestion and immune response make the infection genuinely harder for the body to fight off, and some common medications can even mask the early warning symptoms, letting things progress further before anyone realizes something is wrong. This mistake continues from one generation to the next because nobody ever sits down at a holiday dinner thinking they are taking a food safety risk. They are simply following the same handwritten recipe card their family has always used, sometimes written by someone who is no longer here to ask about it. The good news is you do not have to give up a single one of these recipes to stay safe. Pasteurized eggs are gently heated just enough to destroy harmful bacteria while still whipping, mixing, and behaving exactly like raw eggs in any recipe with the same texture and the same results, and they sit right on the shelf beside regular cartons in most grocery stores today. Now let's talk about how to actually put all of this into practice in your own kitchen, because knowing these mistakes does you no good if it stays theoretical. The best approach is refreshingly simple. Keep the whole egg, cook it fully, and dress it up with vegetables instead of extra fat. The best combination for a heart-healthy plate is 2 whole eggs, a generous handful of spinach or peppers, and a light drizzle of olive oil in a nonstick pan, which gives you real flavor and real nutrition without pushing your saturated fat too high for one meal. The most common mistake people make once they know all this is assuming they still have to give something up entirely, whether that is flavor, a favorite recipe, or simple convenience, when really it is just a small adjustment in method, not a complete overhaul of how you eat. When choosing eggs at the store, look for a carton that feels cooler to the touch with no cracks anywhere on the shells, and check the date before you even pick it up. Consider keeping 1 carton of pasteurized eggs on hand specifically for recipes that call for raw or lightly cooked eggs, so your favorite traditions never have to disappear from your table. If you are on blood-thinning medication, or your doctor has specifically told you to limit cholesterol or protein for a kidney-related reason, this is exactly the kind of change you should discuss with them directly before adjusting your normal habits, rather than guessing on your own. And if you or anyone at your table has a compromised immune system, whether from chemotherapy, a transplant, or another condition, undercooked or raw egg preparations should be avoided entirely. No exceptions, no matter how tempting the recipe looks. Here's the part I want you to actually remember and use starting this week, because this is the piece that ties everything together and makes it stick. Most healthy adults over 60 can safely enjoy 1 whole egg a day, and some can enjoy more. Depending on their individual cholesterol picture and any conditions their doctor is already managing closely, cook eggs until both the white and yolk are fully set, using a simple food thermometer if you want to remove every bit of guesswork, since color alone can fool you. Let refrigerated eggs sit at room temperature for about 20 minutes before boiling to prevent cracked shells and give yourself a more evenly cooked egg with a better texture from edge to center. Add a tablespoon of white vinegar to the boiling water, which helps seal any small cracks almost instantly and makes the shells noticeably easier to peel afterward, especially helpful if arthritis or reduced grip strength has made peeling frustrating in recent years. Keep a carton of pasteurized eggs in your refrigerator at all times, right next to your regular carton, so your favorite family recipes never have to change and you never have to choose between tradition and safety again. So here's the bottom line. Eggs remain one of the healthiest foods you can eat past 60, supporting your brain, your eyesight, your heart, and your energy every single day. Exactly the things you rely on most to stay independent. The 7 habits we just walked through are not reasons to fear your breakfast plate. They are simply small blind spots, and now that you know them, they are easy to correct starting tomorrow morning without turning your whole kitchen upside down. This is not a miracle fix, and it is not a reason to panic. It is a simple, evidence-backed adjustment to a food you already trust and already know how to cook. You are not helpless in your own kitchen. You are informed, and that is exactly what lets you keep enjoying the meals and traditions you love safely for years to come, without giving up a single family recipe. If this helped you see your breakfast differently, tap that like button, hit subscribe so you do not miss the next one, and go check out the related video linked right here on the habits quietly affecting your heart after 60. Take good care of yourself and take good care of that plate in front of you tomorrow morning. If you found this video helpful, please hit the like button. It really helps the channel. And don't forget to subscribe and hit the subscribe button so you don't miss the next videos. I love hearing your thoughts, so please subscribe and let me know what you think. Thanks for watching, and see you in the next video.